Important notice. This video is provided for informational and educational purposes only. It does not substitute professional medical advice. Did you know that lung cancer is one of the most common types of cancer affecting people worldwide? It's known to develop quietly, which makes it essential for us to be alert to the early signs. In today's video, we're going to discuss the 10 signs that could indicate lung cancer, even in its early stages. Stay with us until the end to understand each of these symptoms and learn how they can impact health. Don't forget to like the video, subscribe to the channel, and turn on notifications so you don't miss any health tips. 10 symptoms of lung cancer. 1. Persistent cough. Let's start with one of the most common signs, a persistent cough. A persistent cough is one of the early warning signs of lung cancer. Unlike a typical cough, it doesn't go away after a few weeks and may even get worse over time. Often, it's dry but can also come with mucus or even traces of blood. A prolonged cough, especially in people with no history of allergies or respiratory issues, should be investigated. This symptom is common but can be confused with colds, flu, or other infections. If a cough lasts more than 3 weeks, it's important to consult a doctor for evaluation. 2. Chest pain. Chest pain is a sign that could indicate lung cancer, especially if it's continuous and doesn't improve over time. This pain may be localized to one side of the chest, but it can also radiate to the shoulder or back, increasing with deep breaths, coughing, or laughing. The tumor can press on nerves or cause inflammation in areas near the lung, causing constant discomfort. Persistent chest pain should be investigated, particularly if accompanied by other respiratory symptoms, for an accurate diagnosis. 3. Shortness of breath. Shortness of breath, also called dyspnea, is a common symptom in people with lung cancer. It occurs due to fluid buildup in the lungs or airway obstruction by the tumor, making breathing difficult. This symptom may appear gradually, especially during physical activities, but can also emerge even at rest as the disease progresses. In early cases, shortness of breath can be easily ignored or attributed to other factors, such as age or a sedentary lifestyle. However, if persistent, it should be evaluated by a healthcare professional. 4. Hoarseness. Hoarseness, or a change in voice, can appear when a tumor affects the nerves responsible for the vocal cords. This symptom manifests as a rougher, deeper, or weaker voice. Persistent hoarseness without an apparent cause, like a cold or allergy, can be an indicator of lung cancer, especially if it lasts more than 2 weeks. This symptom is often ignored, but a medical evaluation is essential to rule out serious issues, particularly when associated with other respiratory signs. 5. Weight loss and appetite loss. Weight loss and a decrease in appetite are common signs in cases of lung cancer. This symptom can occur due to the presence of the tumor, which consumes a lot of energy and alters the body's metabolism. Additionally, cancer releases substances that can interfere with hunger signals and digestion, leading to a lack of appetite. This unintentional weight loss can be rapid and unexplained, affecting nutrition and overall health. Along with other symptoms, weight loss can be an important warning sign, indicating the need for a detailed medical evaluation. 6. Excessive fatigue. Intense and constant fatigue is common in people with lung cancer, affecting the ability to perform daily activities. Unlike normal tiredness, cancer-related fatigue is deep and doesn't improve with rest. The body uses a lot of energy to fight the disease, and cancer can interfere with the production of healthy blood cells, worsening the fatigue. If persistent fatigue impacts quality of life and limits daily tasks, it's advisable to seek medical help to identify the cause. 7. Swelling in the neck and face. Swelling in the neck and face can be a sign of lung cancer, especially in advanced cases. This symptom occurs when a tumor presses on the superior vena cava, which carries blood from the upper body back to the heart. With compression, blood flow is reduced, causing blood to pool and resulting in visible swelling in the face, neck, and sometimes the arms. This condition, known as superior vena cava syndrome, may also cause a feeling of pressure or pain in these areas. If it appears, it's important to seek medical guidance promptly. 8. Frequent respiratory infections. When respiratory infections, like bronchitis and pneumonia, become recurrent, it could be a sign of airway obstruction, which is a common symptom in people with lung cancer, as the tumor weakens the respiratory system and facilitates the buildup of secretions. These infections tend to be persistent and may occur several times a year, requiring treatment with antibiotics and other medications. If someone notices an unusual frequency of infections, especially in combination with other respiratory symptoms, it's essential to seek medical guidance for a more detailed examination. 9. Bone pain. Bone pain can be a sign of lung cancer, especially in more advanced stages when cancer may spread to the bones. The areas most commonly affected include the spine, ribs, and arms. The pain tends to be persistent, may worsen at night or with movement, and often doesn't improve with common painkillers. This symptom is particularly concerning, as it indicates that cancer may be metastasizing or spreading to other parts of the body. Persistent bone pain should be evaluated by a doctor, who may order additional tests to investigate its cause. 10. Blood in phlegm. Last but extremely important is the presence of blood in phlegm, which is one of the most worrying symptoms. Even a small amount of blood when coughing can be an indication that something is wrong. This symptom occurs due to irritation or damage in the airways and is usually a sign that lung cancer is already at a more advanced stage. If you notice blood when coughing, it's crucial to seek medical attention immediately. These were the 10 most common signs of lung cancer. If you or someone you know is experiencing any of these symptoms, it's essential to seek medical advice. Early diagnosis can make a big difference in treatment and recovery. Remember to like the video, share this information with those who may need it, and subscribe to the channel for more content on health and prevention.